We are back on The Source. As we know, the Pfizer vaccine arrived in Niagara last week and the rollout of the vaccinations began. There is now a community task force, a coordinated task force that has been formed at the permission of the Ontario government. Jim Bradley joins us, the regional chair, to talk about that and this whole response to COVID. Jim, welcome to the program.
Great to be with you, Mike.
So tell me about this community coordination task force for the vaccine. How did that come about?
Well, we're getting into the stage now where the vaccines are starting to arrive. Initially, of course, the Niagara Health System had a position at the hospital in St. Catharines where they were dispensing the vaccine. And we initially had that. But as we come along, we're going to find out that the vaccine will go to far more than the frontline workers. Obviously, they should be first. The frontline healthcare workers and those who reside in long-term care homes. We felt they should be vaccinated appropriately, and the Pfizer vaccine has been going to them, and we have made great progress there. But as we go along, the general public is going to be involved in getting vaccinated, different categories, and so on. So we decided to form a local task force, which would advise on how best to dispense the vaccines. And we're beginning to put that together at this time, getting representatives from various sectors of the community, particularly the field of healthcare. And we think that that will make a big difference. We, of course, as a region, have been advocating for more vaccines coming to us more quickly. We were pleased to see the Pfizer vaccine here fairly early on, but we also thought we were going to get the Moderna vaccine. That apparently got diverted, as it did with, I must say, a number of other municipalities, got diverted, I anticipate, but we haven't heard this from the province, to areas where the incidence of COVID-19 is even greater. So we're looking forward to Moderna vaccine coming as well, and our whole council and certainly the mayors of our various communities, we've communicated that in a joint letter to the Premier and to the appropriate ministers in the Ontario government. And we're confident that, at least hopeful, that in the future we'll be getting it in a timely fashion so that we're not behind other parts of the province.
The task force itself, Jim, is a method of trying to get some more local control over the rollout of the vaccine. When you mentioned the diversion of the Moderna vaccine, as you say, we don't know for sure that it has been diverted, but the Medical Advisory Committee really made waves with the letter that they published last week.
Well, they certainly did, and we who are the elected representatives joined them in saying to the provincial government that we were disappointed that the Moderna vaccine did not arise and that we wanted to see it as soon as possible. But when you hear it from the medical community itself, you know this is not political posturing or anything of that nature. It's a genuine concern about people in our area being treated in a fair way, and that's why we look forward with anticipation to it coming, we hope, in the near future.
Jim, with your 30 plus years at Queen's Park, the communication between the local municipalities and the province, are you feeling at this point in time in your position as regional chair that you are being heard by the provincial government?
I think they are facing representations and pressure from all over the province. And we have, as I say, we were delighted to get the Pfizer vaccine here early last week, and I think that's exceedingly important. But we collectively, as a whole group in Niagara, not only municipalities, but others, along with the medical community, felt we should be receiving even more of the vaccine and more rapidly, because on a per capita basis, not in total numbers, but on a per capita basis, we're right up there with the communities such as Toronto and Peel in terms of what is happening with COVID-19. And you will have noticed our raw numbers in recent weeks have been in the three-figure column. In other words, 100 and some, as opposed to being 18 or 19 at one stage where we found it manageable. So knowing that, we wanted to communicate to the province that we really do need it now, as well as other areas of the province, because of our circumstances we're confronting now. And The province is trying hard. They have to deal with so many different communities and so many different pressures. So we understand that it's not easy for them to make these decisions.
Regional Chair Jim Bradley, thank you for joining us on The Source today.
Happy to be with you today.